A patient today asked about carbamazepine or Tegretol for the treatment of their mood disorder, their bipolar disorder. Tegretol is a medication that's used in various seizure disorders by neurologists and other medical providers. It's used for certain pain conditions, for example, trigeminal neuralgia, which is a condition where individuals have really severe pain on their face, basically the areas that are innervated by your trigeminal nerve. And it's also used, and I consider it really a second line medication for bipolar disorder, because I've personally found that it hasn't necessarily been as effective as some of the other medications out there used to treat bipolar disorder, but for some patients it is rather effective and it is well tolerated, and so it may be the right medication for some of my patients. Trileptal or carbamazepine does have potential for side effects. There may be a little bit less weight gain. I noticed with this medication and some of the other psychiatric medications used in bipolar disorder, so sometimes patients will want to do a trial of this medication for that reason. When people start this medication, though, they may have a little bit of an upset stomach, diarrhea, headache, feel a little bit dizzy, feel a little bit overly tired or sedated. Some individuals will feel increased anxious energy. It's called activation with this medication, so that can certainly occur. Many of these side effects are transient, so they will go away over time for a lot of patients, but not for everyone. And then there certainly are some severe side effects that can occur with this medication. For example, if someone develops a rash and they're taking this medication, they really need to stop it immediately and then see a medical professional to make sure that they don't have Stevens-Johnson or TEN or another serious skin condition. Some individuals have an allergic reaction to this medication, which can actually cause anaphylaxis or a very severe allergic reaction. It can result in edema or different types of swelling in your legs or throughout your body. It can cause emotional fluctuations or changes that can be problematic. It can cause fluctuations in sodium levels. It can cause something called SIADH. And so if someone is taking this medication and they are showing some symptoms of confusion, you really need to make sure that you check a sodium and that individual is seeing a medical professional immediately to make sure that they're not becoming, not having a severe reaction to it with fluctuations in their sodium level or having a change in mental status for other reasons. There are various other side effects that can happen with this medication, but it is something, again, that I consider a second-line medication for bipolar disorder treatment, and it does have other indications in the medical field. If you believe this video pertains to you in any way, please be sure to speak to a medical professional, as these videos are meant to be informative only and not medical advice.